Lucas is set to begin speaking here about what lies ahead for the city of Kansas City, Missouri. Let's go ahead and listen into this press conference at City Hall.
Across our region, 135,000 people have tested positive for COVID-19, 32,000 of those people in Kansas City, Missouri. And across our region, 1,642 people have died of COVID-19, 373 of those in Kansas City. Our 7-day average, our daily average for deaths in our region in the first week of 2021 was 6.6, nearly half of the rate that it was in December of 2020. What that tells me is that our interventions have worked. Those interventions aren't just curfews. Those interventions aren't just mask requirements. Those interventions are also the fairly strict enforcement that we have done in Kansas City, Missouri. And I think we've been unique among jurisdictions in doing so. When we've heard complaints, we've closed down bad actors. When we've seen masks not being worn at indoor facilities where people are close, we've shut them down. We've allowed businesses to try to cure those problems. We will continue to do that. Nothing that we say or do today suggests that we're being any less serious about the threat of COVID-19. Nothing that we say or do today suggests that we're not still in a moment of crisis. And as part of that, we will extend our state of emergency in Kansas City until May 1st. I will say that I'm not one who likes to have a perpetual state of emergency, and I hope by that point we may be in a position where, while we're addressing the COVID-19 crisis long term, we're in a position to say that we don't need the same strict rules, we don't need some of the same emergency procedures. However, we are not at that point yet. The updated order that I'm discussing today will take effect at 10 p.m. today. One of the most talked about issues, and we've noted some of the changes around the region. In fact, I had a conversation with other jurisdictions both last week. I talked to a number of Johnson County commissioners yesterday. We will join the rest of the region with a midnight closing time, and within the month, we will review whether that closing time should either be extended or if that closing time should actually be more restrictive thereafter. As always, we will base it on science and data and facts. We've been heartened by the fact that after we issued our orders in November, and our goal was to make sure there weren't large crowds gathering during Thanksgiving, during the Christmas holiday, during the New Year's holiday, we've seen case rates among those who are ages 18 to 29 drop at almost 50%. Before that point, we had a crisis among those who were younger adults. We had a crisis because we saw crowds that were gathering at bars and at restaurants. Those interventions have worked, particularly during our significant holiday-related events. And so that is the reason, and indeed the only reason, why you're seeing some change in Kansas City's approach to the crisis now. We'll come back to you within a month, and we hope at that time we might be able to say that we can get back to business as normal. We'll go back to normal closing times in Kansas City. Indeed, that is my hope beyond all hopes. However, it will be based on how we're doing. It will be based on our hospital space. It will be based on infection rates. It will be based on fatalities we're experiencing in this area. As before, restaurants will be required to maintain social distancing between different parties and limit the number of occupants indoors to no more than 50% of building capacity. Indoor and outdoor patrons at these facilities, including bars, must be seated and masked at all times unless eating or drinking. And importantly, that seating requirement is important. We are not having big dance parties. We're not having some of those things that we've seen contribute to the spread. And restaurants, taverns, and bars, by virtue of direction of both this order and the Director of Public Health, must immediately report known cases of COVID-19 to the Kansas City Health Department. We're also continuing our limit of 10 people max for any indoor gatherings. And patrons of gyms, fitness, and recreational centers are still required to wear masks at all times in these establishments. A few other things I'll talk about: enforcement, vaccinations, and our business relief orders as well. Since our updated order went into effect in November, Kansas City's Regulated Industries Department has completed more than 315 inspections. And I will say this in credit to Kansas City and its order, because I don't think everyone has enforced the same way. When you have called Kansas City government with concerns about our enforcement apparatus, we have listened, we have followed up, we've made sure that there's compliance in every part of Kansas City. We will continue to do so. This includes 25 inspections that were made just last weekend, where 5 violations were found. Regulated Industries and our health department have been able to help businesses importantly develop compliance plans. Our goal is not to shut anybody down, but it's to keep patrons safe. It's to keep our communities safe. In terms of vaccinations, the Kansas City Health Department has now received vaccinations this week and we'll be working, importantly, in the world of vaccinations. For us, the important goals are that we're equitable for all communities, that we make sure that we have vaccine rollout that's efficient and effective for those who are over the age of 65, for those who are in at-risk groups, and for populations that often have been hard to reach, including our black and brown populations. I'll note that our Latino population has been disproportionately impacted both in infections and in fatalities in COVID-19. We'll make sure that we have significant outreach, and that's why I think the health department is so important. We will work with our hospital partners. We'll work with both our safety nets, institutions, and more. But it's important as a health department that we do work to ensure that every Kansas Citian who needs access to the vaccine receives it as efficiently as possible. That will save lives. We will also make sure we continue our outreach in all populations to show that the vaccine is safe, to show that we'll be fair in how we administer. Our city manager, Brian Platt, will come up in just a moment to talk about our other efforts as it relates to large-scale vaccination facilities. As you know, in Kansas City, we are blessed to have several large facilities, a convention center, an arena I can see right now, and others. And we'll make sure that we're working with other organizations, both Veterans Administration, so many others, to make sure that we're looking to our long-term vaccination efforts. But I want to note two other areas. In business relief,
you're listening in here as the Kansas City Mayor, Quinton Lucas, extends the state of emergency for the metro area to now May the 1st, but easing up a bit on the closing times for bars and restaurants, extending them from 10 p.m. now to midnight, still maintaining the same limited capacity, 50% with social distancing and mask wearing still being mandated, and a 10-person maximum for any indoor gatherings. We will continue to listen to what the mayor has to say here and what the city manager will say shortly afterwards and bring you further details on later newscasts. But that is the latest, the big news being an extension of the state of emergency from, it was set to expire here in the next couple of days, has now been extended to May 1.